If you're an IBM retiree, you've probably already received a notice about their changing retiree plans to a United Healthcare Group Advantage plan. A number of our clients are IBM retirees who chose to work with us in years past and have asked my opinion on the new Advantage plan, the new Group Advantage plans. So I've read the material and have seen the presentation by United Healthcare, and I believe it certainly deserves some comments and clarifications. And that is what I'm going to do with this video. If we haven't met yet, my name's Matthew Clausen. I'm CEO of MedigapSeminars.org. My company is a full-service, independent Medicare insurance brokerage that helps people with their Medicare and retirement decisions in 49 states. We work with Medicare Advantage Plans, and we also work with all of the Medicare supplement plans. So my thoughts on the 2023 Group Advantage plans for IBM retirees. There are some rules I have to abide by in the making of this video. Medicare is strict on what can or cannot be said in this format. Still, what I have to share with you should be helpful if you're in the process of evaluating these new plans. So let's start with the fact that IBM has stated that nothing will change with your plan unless you act. Change is not automatic. If you're still using VIA benefits for a supplement as of January 2023, you're no longer incentivized to use them. I'm pretty sure we can lower your premiums. The supplement plans from VIA benefits, the ones that they offer, are specially priced for those who have chronic health problems and need a guarantee issue. They did that because they don't want anybody being rejected for their plans. But if you're not in such poor health that you need a guarantee issue, you will be surprised when you see the prices and how much less you can pay for your supplement plans. So hopefully you'll let us compete for your business. So there's a link in the upper left corner of the video and in the video summary down below to link and contact us. Our services are free to you, the consumer. So a dose of reality here. IBM retirees who went with VIA benefits years ago because they were told that is what they have to do in order to get the IBM subsidy, now we're forced to make a change or lose that IBM subsidy. So even if you're happy with the plan, you're forced to change to keep the subsidy. So now in the VIA benefits plans, for example, you're likely in some overpriced Medicare supplements and are facing the loss of your subsidy as of 2023. And honestly, without that subsidy, the prices on those plans were not even competitive. So how long before this new choice that they're making now changes? I don't know. But let's take a look at the choices. So the information about the Advantage Plans program has been presented by United Healthcare via an online presentation and a direct public internet link. As with all sales presentations, there's a caveat emptor factor. We can't fault United Healthcare for wanting to or trying to sell their plans. That's their job. And in doing so, they're presenting those plans in the best possible light and perhaps not saying things or leaving you, as they say, caveat emptor, to figure out what is not said. So I'm going to fill in those gaps and clarify the areas that confused my clients or left them with a false impression. United Healthcare is offering you to choose between one of two different group Medicare Advantage PPOs. One is called Essential, the other Enhanced. These are custom-designed Medicare Advantage plans, but they are still Medicare Advantage plans with the same limitations of an individual Medicare Advantage PPO. The presentation used some words that I would call scary clever. That's misled some of my clients and led them to believe that there are benefits that they don't actually have. So let's start with this slide from the presentation. In the first line, they state that the plans have combined features of Medicare Supplement, Part D, and Medicare Advantage plans. This is the first of a series of comments that led people I've talked to believe that this is some enhanced Medicare Advantage plan. It's not. And by the way, all Medicare Advantage plans are custom designed. Some are custom designed for your area, your region, some for a specific group, like these. The plans being shown for 2023 are Medicare Advantage prescription drug plans. They are nothing more than a Medicare Advantage PPO with a bundled Part D plan. I've looked at all of the material provided, including the summary of benefits, And I cannot find any specific feature of a Medicare supplement plan within these plans. None. So let's look at slide number 2. There are 2 terms that I would like to outlaw from Medicare Advantage Plan lingo because they have resulted in confusion and misunderstanding by both Medicare agents and the public. The first is that Medicare Advantage plans have all the benefits of Medicare Part A and Part B, which is what they say here. That is not true. Medicare Advantage plans do not have all of the benefits of Part A and Part B. They have benefits from all of the same categories of coverage. There is a big difference. It's like saying that Ponderosa Steakhouse has all the same meals as Ruth's Chris Steakhouse. Are there any Ponderosas left? I haven't seen one since I was young. Anyway, you can get steaks at either restaurant. They are both steakhouses, but they're not the same. I'm going to give you a real-life example of this in a moment. So term number 2 that I would ban is also coming up in just a moment, so bear with me. Right after this part of the presentation, they state that with these plans, these Advantage plans have all the rights and privileges of Medicare. Just to be clear, your Medicare rights refer to a non-discrimination clause and that you're to be treated with respect. And it also has to do with your right to appeal. It has nothing to do with your benefits. You can Google your Medicare rights and privileges on Medicare.gov and come to the actual definition. But the timing and emphasis on this statement has confused at least my clients and leaving them to believe that it's something to do with benefits. It's not. But an important difference is that with original Medicare Part A and Part B, so if you had Medicare and a supplement, and you appeal directly with Medicare, Medicare doesn't have any skin in the game. When you have an Advantage plan, you've traded in your Medicare Parts A and B for the Advantage plan. You must deal or appeal directly to the insurance company, not Medicare. So yes, you have the right to appeal, but you're working with a for-profit insurance company, not Medicare. Now let's look at slide number 3. This is the slide that broke the camel's back with me and motivated me to make this video. In my professional opinion, it leaves the viewer to believe what is not true. It certainly would not pass muster in my company. There are several things wrong with this slide that I simply find not acceptable. They use this chart to associate the benefits of their Advantage plan with the benefits of a Medicare supplement. They are not the same, not even close. And this goes to the second statement I would love to see banned because it has confused so many individual consumers and agents. We often hear an agent, when presenting an Advantage Plan PPO, say you can see any doctor that accepts Medicare, and if they are not in network, they'll simply be out of network. And some have even added the clause, just like a Medicare supplement. In this case, they state that with the United Healthcare Advantage Plan, PPO, you can see any medical provider that accepts Medicare and the plan. To be accurate, this should be rephrased. The word can needs to be replaced with you may ask any doctor that accepts Medicare if they will accept your United Healthcare Advantage Plan as an out-of-network provider. They can and often do say no. They are under no obligation to accept your plan. This is not like a supplement where any doctor that accepts original Medicare will accept your supplement. And then not only can you see them, but Medicare and your supplement will pay the bill. I had a client about 4 years back that had developed cancer. She had a PPO Advantage plan. She wanted to see certain cancer specialists who were not in network. Her life was at stake and she just wanted the best care she could get. Every doctor she asked said no. They did not want to accept her Advantage plan, PPO. And by the way, the insurance company she had here in Florida was the second largest Advantage plan issuer in the state. It was one of the greatest and last disappointments of her life. Another case, just a week or so ago, Mayo Clinic released a letter, and I believe this is the 3rd consecutive year for this letter, stating that they do not accept Medicare Advantage plans. If you want treatment at Mayo Clinic in Florida or Arizona, You must have original Medicare and preferably a supplement. I can go on. If you want more of my thoughts on this, please see my video titled Medicare Advantage Plans Explained. I'll have it linked up here. The fine print of this IBM-sponsored Advantage plan states that if an out-of-network provider participates in Medicare and also accepts this plan, this means that the provider or the hospital agree to treat you and be paid according to UnitedHealthcare's payment schedule. Many doctors who have had poor experiences with certain healthcare plans or certain insurance companies just don't want to accept them anymore. My wife, who is also here, works with me now as a Medicare advocate for our clients, was manager of billing at a Jupiter Medical Center here in Florida for a long time. She got to see a lot of the games and the issues that insurance companies play. I'm not picking on UnitedHealthcare, it's all the insurance companies. When they're regulated and not standardized, they always push the edge of the envelope, as they say. But with original Medicare and a supplement, you can see any medical provider in the United States or its territories as long as they accept original Medicare. They will accept any Medicare supplement from any insurance provider. And they can do this because they do not bill the supplement company and the supplement insurance company. They bill Medicare. Medicare then electronically informs the supplement of what it's to pay and when. In addition, no insurance company can interfere with your care. There are no pre-authorization requirements, and there's no insurance company that can deny your treatment or deny the treatment that your doctor wants to provide to you. UnitedHealthcare does require pre-authorization before allowing your doctor to provide recommended care, and it may not allow all or what is recommended. And of course, I have to comment on this wording, all the features you want. I want all the medical recommendations made by my doctor without having to get permission from an insurance company. So this chart also has a glaring error regarding worldwide coverage. All of the most popular Medicare supplement plans, including Plan G, Plan N, Plan C, Plan D, Plan F, Plan M, and the high deductible plans all provide international emergency coverage. They have for at least 13 years, I think since 2010. So I'm not sure how UnitedHealthcare missed this on that chart. Again, I have more examples than I can put in this video. Plus, I have two separate reports from the Inspector General's office, Inspector General of Health and Human Services. One was dated 2018, the other in 2022. Same office, but two separate people and two separate studies discussing the denial and delay of care that is rampant within all Medicare Advantage plans. And I'm not saying that everybody with a Medicare Advantage plan has a bad experience. That is not the case. We do work with Advantage plans, and there are people very happy with their plans. The problem is because of the insurance companies and the way they're set up, there are a lot of people that are very unhappy with their plans. But what I have next here should fall under the category of doing your due diligence before making a decision. And I'd like to thank my friend and fellow YouTuber, Christopher Westfall, for pointing out this particular article. I'll try and show it here. See if it gets on camera. It's linked below, and it deserves a full read, and even mentions UnitedHealthcare. The title is, Advantage Plans May Shorten Stays to Less Time Than Medicare Covers. Wait, didn't they say earlier that Medicare Advantage plans cover everything that Medicare Parts A and Part B cover? But this is less coverage, so how could it be? My feigned surprise. They both cover physical therapy. That's the category. It's just that Medicare covers the physical therapy that you need as recommended by your doctor. Advantage plans will often cut you off when the bill is too high. So this is a great article with a lot of information and real-life examples that include UnitedHealthcare, and I hope you read it. Last slide, and then I'm going to wrap up, and I'm going to show you where you should look for more information and what should have been in this presentation. Whenever you see a statistic that is, for all practical purposes, 100%, you should question the methodology behind the result. In this case, 99.9% of the members continue to see their chosen provider. I think that could be considered misleading. This is very likely measured after the fact. In other words, it's only measuring the people who have already chosen to go with the Advantage plan. Now, assuming people check with their providers first, just going with the plan would and should eliminate all those providers that do not accept the plan. That's the only way that you can get a 99.9% coverage in a country where only 45% of all doctors accept any Medicare Advantage plan, let alone a specific Advantage plan. So this statistic is like saying that 99.9% of policyholders who submit a claim to United Healthcare are insured by United Healthcare. Yeah, that's because those not insured by United Healthcare wouldn't submit a claim to United Healthcare. Like I said earlier, it's scary, clever wording. I suggest that if you're considering this, that you go to the summary of benefits, which should have been in here, and when we as individuals present Advantage plans, that's what we have to start with, required by Medicare. Group Advantage plans don't have the same requirement. So go to the summary of benefits. You're going to find it under the plan guide, starting on page 24. You'll have a summary of benefits for both. So you go to the link that they provided. That's the retiree.uhc.com/IBM. Click on Coverage and Benefits, then Plan Guide. Then look to page 24 and on. Also, look at what these plans will cost. In my opinion, the Essential plan is comparable to most any other individual plan, any other Advantage PPO. It has a $5,000 maximum out of pocket. The Enhanced plan is better, but it comes with a premium. And you need to weigh the good and the bad here relative to your other choices and, of course, your situation. In many states, you can get a Plan G supplement, the best health care available in the United States, plus a Part D for what the Enhanced plan costs. Then you would have no worries about your health care and networks. And by the way, if you're comparing the price of a Plan G, don't assume that if you have a Via Benefits plan that that's the same price that you can get, by shopping the plans. It's not. I've seen people have a $200 Via Benefits plan, and we can find the exact same plan. They're standardized, so they're exactly the same from one company to another for like $140. But you need to consider everything. Consider that these benefits, the benefits of Advantage plans, change every year. That's why there's an annual enrollment, so you can review the changes as proposed for the next year and choose a plan that fits your needs. Now, if you like shopping for health insurance, then an Advantage plan is a great choice. You don't get to do that with a supplement because they're guaranteed renewable. The benefits of a Medicare supplement never change, so there's no need for annual shopping. Of course, also consider the IBM subsidy. Is that an amount of money that is worth the limitations of an Advantage plan? Only you can decide that. IBM has already shown a propensity to change plans and force a change to keep the subsidy. You should consider that. But my company tagline is make an informed decision, and I hope that this video is helping in regard to that. There are extra benefits to consider, but please remember, as I've said many times in my other videos, whether you have a supplement or an Advantage plan, these extra benefits like gym benefits, gym memberships, there we go, and dental can be taken away or substantially modified every year. When you look at the summary of benefits, remember, you're looking at a 2023 plan. The 2024 plans will likely be different, as will the 2025, 2026, and so on. All those extra benefits can be purchased on an individual basis, and that makes them yours. They can't be taken away when you do that, and they can't be changed. Just a couple weeks ago, I published a video called Medicare Advantage Plans Explained: The Secrets of Who and Why. It goes through the demographics of people who make specific Medicare choices, including those who choose a Medicare Advantage plan and the individual plan and separately the group plan. It's worth seeing. It's always helpful to know what your peers have chosen and why. The bottom line is that what I saw as a fancy sales presentation from United Healthcare, it was just it was a sales presentation, but there's really nothing fancy about the group Medicare Advantage plans. They're simply Advantage plans that provide an incentive to the employer. They have all the benefits and limitations of an individual Advantage plan PPO. If you'd like to see the Medicare supplement plans that are available to you, just use the quote request linked in the upper left corner to provide us the information that we need, and we'll get that information out to you. And if you like this video, please like it if you found it of value and share it. We'd love to see that everybody who really wants to make an informed decision have the information they need. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.